for joining us. I know that some of you received from Jen West a copy of the Medical Officer of Health's Directive to Long-Term Care. And so what we would like to do today is just review that and then review the revisions to our actual policies. I will send the revised policies out to you. And if you are an essential caregiver, you need to, as we have in the past, review the policy on a monthly basis. However, it seems like it changes more often than monthly, so I'll send that out after the meeting. So as you may be aware, on November the 3rd, the Medical Officer of Health for Simcoe Muskoka sent out a directive to all long-term care homes in the county of Simcoe and the district of Muskoka to immediately cease all indoor visits at the facility with the residents, and they're talking about the general visitors, so that's the people who call us and make an appointment and then come into our lobby area and meet with their loved one. And that's regardless of whether the facility is currently experiencing an outbreak, which we are not. Immediately limit all indoor visits, so only one essential caregiver can visit a resident at a time. And although you don't need, in the policy says that you don't need to schedule the visit, but we kind of need you to do that because we don't have someone at the screening table 24/7. And that way, when we know you're coming, we are able to put someone at the screening table to be able to let you in and screen you. So that doesn't really change. Also, immediately cease permitting residents to leave the facility for short stay absences and temporary absences. The exception to this is those that are required need to go out for healthcare reasons, and I'll cover it more when we get into the policy. He's defined an essential visitor, which we consider an essential caregiver, so it's just different terms. The reasons for the order was that Simcoe Muskoka District Health Unit feels there's a risk in Simcoe Muskoka. Our residents are older and much more vulnerable, and there's been a significant increase in the province as well as in Simcoe County. The residents of long-term care homes are on average older than the general population and are more vulnerable to the health impacts. So the ongoing and safe operation of these facilities and the ongoing daily care of the residents at the facilities depends upon the ongoing availability of the facility's qualified health and willing essential workers. So, it's just, I think we're just taking a couple of steps back from where we were during the summer. So as a result, in Dr. Gardner's opinion, it's based on reasonable and probable grounds that communicable disease exists or may exist, or that there is an immediate risk of an outbreak of a communicable disease in the health unit served by Dr. Gardner.
Sure, just stop. Ask if people
can you hear me okay?
Can someone reply?
Can someone reply on the live chat and let me know if you can hear me? No. Okay. Short stay absences and temporary absences. The exception to this is. So just give us a second to correct the issues. Those that are required for to go out for healthcare reasons, and cover more when we get into the policy. He's defined an essential visitor, which we consider an essential caregiver, so it's just different terms. The reasons for the order was that Simcoe Muskoka District Health Unit feels there's a risk in Simcoe Muskoka. Our residents are older and much ensuring a safe operation of these facilities and the ongoing daily care of the residents at the facilities depends upon the ongoing availability of the facilities qualified health and willing essential workers. So, you know, it's just like steps back.
That's for when it wants to
So
talk.
as a result, in Dr. Gardner's opinion,
See, that's what I'm
based
getting, so
on
I can hear it.
probable grounds that communicable disease exists or may exist, or that there is an immediate risk of an outbreak of a communicable disease in the health served by Dr. Gardner.
Ask the people.
Can you hear me okay?
Someone reply.
Can someone reply on the live chat? Let me know.
It's all there.
Okay.
So,
Are you able to hear? Just give us a second to hear it. Yes. No.
I don't know what to do other than to talk louder.
So we're not sure that the problem has been fixed, so Derek is suggesting I talk louder. So please let me know, is that better? You need to be closer to the mic. Where's the mic? Oh. I didn't bring your mics in. I can't really get any closer to the mic because the mic is on the laptop. They can hear that in the background. Okay, I don't want to waste your time if you can't hear me. I wanted to quickly review. Oh. What am I doing with this? In my ears?
Hey, are you able to bring your microphone?
There's a mic right here.
Okay.
This is a mic.
Okay, try your test now.
Okay, I'm testing it now. Can you hear me better? Somebody said that is better. Yes.
Okay, go ahead.
Okay, well, okay, so what I wanted to do is just quickly review with you the changes to our policies. And then sometime this afternoon, we will send them out to you and you can read them at your leisure. So this is based on the order of the Medical Officer of Health issued on November the 3rd, 2020. And Premier Doug Ford lays out a framework with specific criteria to impose regional restrictions. So Dr. Charles Gardner made an order of the Medical Officer of Health under the Health and Protection and Promotion Act of 1990. Due to, well, I can't say due to the cold weather and snow, the outdoor visitation booths and shade tents have been removed. I guess we were a little hasty. We did take them down in October. And then, of course, we've had this beautiful weather. So they are gone. And I know that we'll soon be getting the snow that Saskatoon is getting. It's still important to, as I mentioned before, to make an appointment. General visitors are not allowed. And of course, people coming in, nothing's changed. You still have to attest to the fact that you've had a negative COVID test and that you are required to wear full PPE.
sorry, I just don't, I want to repeat stuff. During the identified visiting hours, scheduling of the visit by one caregiver at a time is not required, and the length and frequency of the visit is not restricted unless otherwise directed from public health and/or management. If there are concerns regarding the safe management of residents. To ensure there is a screener at the door, however, you should get in touch with Amy. Just talk quickly about what would happen in a palliative care situation. So only one palliative visitor can visit an ill or palliative resident at one time. So it can be more than one person, but only one person at a time if you have a loved one who is in palliative care. That's been said, so I don't need to repeat that. Okay. So that is the visitor policy changes. Really, it's just to do with Dr. Gardner's order. So short-term and temporary absences. And thank you to all the families for keeping your loved ones safe and not taking them out for coffee, or we were taking them out on the bus, and now we've been told we can't do that right now just because we're in yellow. But I do want to thank you for keeping the residents safe. So I'm just going to mention it. BRHD has ceased permitting residents to leave the home for short stay and temporary absences, except for those required for healthcare reasons. A short-term absence is only permitted for healthcare reasons and will not be allowed if the home is in an outbreak, except in a healthcare emergency. So this is where the biggest change, I think, comes into play. So if the resident was to have a healthcare emergency and they were to go to the hospital, they would only be allowed to stay not more than one overnight stay. And if they do, then it becomes they are discharged for medical reasons to the hospital, and then they have to be readmitted. If someone was to go out for a medical appointment, or if they had an emergency medical issue and the ambulance came and had to take them to the hospital, if the home goes into outbreak during that, if the resident is at the hospital, they will not be allowed to return until after the outbreak is over. If a resident is going out, say, for an appointment with maybe the dentist or something like that, a couple of hours, and during that time we went into outbreak, they would be, of course, allowed to come back. So I think that again, highlighted in the policy is a temporary absence is only permitted for healthcare reasons, example, hospital admission. No temporary absences are permitted except for healthcare emergencies if BRHD is in an outbreak. In the event that an outbreak is declared BRHD and the resident is currently on a temporary absence from the home, the resident will not be readmitted until the outbreak is over. And I think this just kind of reiterates that. So the only absence for the residents at this point in time is the medical one. So that's the changes to the policies, and I know you all got a copy of the order. Since I had you chiming in, I thought I would give you a little bit more information just so that we can make sure that the information is forthcoming to you. I've talked a lot, I think, about the resident care assistant that we've been looking to hire to help us with our residents, especially as we're having in the last month, we've only been able to hire one PSW, and we actually have an interview with another PSW this week. So we have now 2 full-time resident care assistants and 1 part-time. We also have 8, and most of them are students that are cross-trained as either a resident care assistant, housekeeping, dietary, screening, and cleaning. So that gives us a little bit of a pool that we can work from. The ministry, as you know, has made lots of announcements about trying to help long-term care. One of them was Health Force Ontario. So they put out, I guess, information to recently graduated PSWs that they could apply to Health Force Ontario. They would get an incentive of $5,000, $3,000 from the ministry, $3,000 when they started, and then the other $2,000 after 6 months. As soon as it came out, I applied for it. We were approved 3 positions, which would mean if there was 3 people who went through Health Force Ontario and wanted to work for us, they would get their incentive and they would work for us. We've had 0 people apply. So we are looking for a registered nurse. So if anybody knows of an RN that's looking for work, we're getting pretty desperate. Today, the ministry announced another new incentive program to try and get people into work in long-term care, and it's called the RSA program, which is resident support assistant, which is the same as our resident care assistant. And this is through Workforce Ontario. So they're looking at people who are currently unemployed or have been displaced from the retail and hospitality industries or administrative roles, as well as students in education programs. So these interested individuals have to create a profile for the Ontario Matching Portal where they will be screened, trained, and matched with a long-term care requiring support. It does say that only homes that are not in outbreak may apply. That would be us. But it also says that they're looking at areas of greatest need, which is Toronto, Ottawa, and Peel. So it's certainly something we'll be part of and hope that, you know, there's a way for us to get more staff members. I just wanted to let you know that the $3 incentive that Ford mentioned, I don't know, over a month ago, we've heard nothing, so there's nothing happening there. The University of Western Ontario is looking for family members to participate in research exploring the social connectivity in context of COVID-19 and long-term care. I will send this little poster out with everything else today. If you're interested, you can contact them directly. Let's see if there was anything else. Yes, I wanted to let you know also that, just to give you a little bit of insight, COVID cases update. This was as of Thursday last week. November 5th, according to this list, there are 89 long-term care homes in outbreak in the province. Additionally, 299 long-term care homes in the province have now been resolved of their outbreaks. And then I just have a list. Jack, I can actually look up the homes. So I'm pleased to say that, you know, we're not on any of those lists. And I look at what's going on in the community and think how easy it would be for this very insidious virus to get into the home. And I look at Beaton and what's going on down there, and what the stories that I'm getting in regards to the hospital taking over the home, and it's just very interesting. And someone mentioned that if that was to ever happen here or to a not-for-profit organization, it would bankrupt us, because they are a municipal home, so they're able to do this, I guess. But the hospital told them that each resident had to have their own blood pressure cup. They could not take the cup from one room to another. And the home has over 120 beds, so that's a significant amount of money just in that. They have taken away everything in the residence room except for a bed and a night table. The residents get tray service, so I don't see a chair. So they're staying in their bed in their room, and they're I've been told, trying to turn it into a mini hospital. So we did have a session with the IPAC team from our VH. We did very well on that. So hoping that obviously that we don't get anything, but if we do, we have 2 isolation rooms ready to go, and we're just continuing to do the very best that we can. So I don't know if anybody has any questions for me or. Oh, somebody said much better. Stop yelling. Sorry, I didn't see that. So I was talking with Amy, and she did mention that there are a lot of window visits going on, which of course I understand, and thus I guess we're going to go back to our Skype and FaceTime and those kinds of things for the winter months. It's absolutely beautiful out. The residents are allowed to go outside. They must remain on the property. So what we've put in place is that the residents can go out into the courtyard. If their central caregiver would like to take them out into the courtyard, they can do that as long as there's the distancing from any other resident that may be out there. So the residents do get the opportunity to enjoy this weather if they wish. We have Remembrance Day services happening on Wednesday, and we will make sure that all of the residents are able to participate if they wish to. So there's a question here. Due to my mom's mental state, can I get more updates on how she is doing at 104? Is she involved in anything? Maybe a picture? I will write that down and see what we can do in the way of giving you more updates on your family member. And somebody has said, thanks for all you do. Oh, and I do want to say thank you so much. After my last family meeting, where I was telling you about what we needed, we had some very generous donations. So we're able to buy our cubby holes for our shields. We're able to get some stools and some other things that we feel would help with our infection control prevention. So thank you for your generosity. It is greatly appreciated. I sincerely appreciate all the FaceTime calls provided by Amy. Yeah, she's pretty good. Very versatile. Well, I guess if there aren't any more questions, I'll wait another minute or so. But if there isn't any more questions, please remember, if you're an essential caregiver, to read the policies every month or as they are revised. We will keep you informed of anything that changes. You often hear at the same time we do. And then we have to scurry to make sure that we're doing things properly. But that's okay. As long as we can keep our residents safe, we don't mind. Somebody said Thanks for all you do. Yeah, you're very welcome. As Derek often says, you've entrusted your family member with us. They're part of our family, and we're going to do the very best we can to take care of them. So I guess until next time, thank you for chiming in. Take care. Be safe. God bless.
Yes.
Sorry, yes.